Hello, everybody. My name is Pascal Augustine. I am a licensed certified clinical social worker and a licensed clinical alcohol drug counselor. I've been working in the field for about 21 years and providing clinical counseling, working in the field as a counselor, a social worker, administration, program development, you name it, I've done it. I had the luxury of working with Rutgers and doing an apprenticeship program with individuals who are seeking to become alcohol drug counselors. And I have two individuals who participate in that apprenticeship program with me, and we'll be able to discuss in more details about the program, how it was, what we learned, what we ideas that we may have to try to improvise it, and what were the benefits, and some also to some of the pros and cons that the limitation that we did have as being part of the program. I would like to introduce the first one, Elizabeth Rogers. She's one of the participants, employee at Human Solutions Industry Incorporated, and Osmond Davis is another employee at Homeless Solutions Incorporated, and they both are participants in the Rutgers C Certified Alcohol Drug Counselor Apprenticeship. So, Liz or Osmond, if one of you guys want to start off and just tell us a little bit about yourselves and how did you feel about being in the program?
Okay. Hi, everyone. I am Elizabeth Rogers. I am the mental health and addiction specialist at Homeless Solutions. I have my bachelor's in sociology. I did a concentration in social service, and I've been working with the mentally ill population for the last 10 years. I've been with the shelter for 7 of those years, and the population that we work with is primarily those who have a history of substance abuse and or are co-occurring. Participating in the CADC program was very beneficial because it helped me hone my counseling skills and get a better understanding of the struggles many of our clients deal with on a daily basis. The various counseling methods, the stages of change, the quadrants of care, and implementing treatment plans for my clients has not only improved my work, but also my client success rate. Now, going through the program, I'm able to identify where a client is within the stages of change, determine the best course of action for them as an individual, and I'm able to accept that the unfortunate reality is that you can't save everyone if they're not willing to help themselves. When it comes to working with those who have struggled with addiction, they can't want to change for themselves, for anyone other than themselves. So that's something that, as working in the social service industry, it's really hard to see someone struggling and you want to help them, but you can't work harder than they are willing to work for themselves. I've had amazing successes, but I've also had those who've cycled back time and time again. And in the long run, most of the time, more than not, they'll come back and they will always thank us for the help that we've given, whether they've succeeded or not, due to the support that and counseling and just overall assistance we've provided during their time in program. So with that said, Osmond, you want to take it from there?
Sure. Thanks, Elizabeth. Hello, everybody. My name is Osmond Davis. I'm a division manager of Homeless Solutions. I've been with Homeless Solutions for since 2009 as a safe haven case manager. I've grown in the organization. Became a senior case manager, and then now a division uh, manager for managing the safe haven division. Um, so basically, I obtained my bachelor's degree from William Patterson University. And when I got my master's from University of Phoenix, and I was fortunate enough to be part of the Rutgers program, CADC program, that Pascal, officiated. Um, just want to say that after the CADC program, with Pascal, it kind of opened up and gave us a different mindset of how we go about, dealing with operational on a day-by-day basis, how we operate. Um, we identify this. Basically, we're able now more than so to identify the stages of recovery. Um, by using motivational interviewing, we're able to build our rapport with our guests and better assist them in their stages of recovery. All right. So now we just doing the program. We did role playing that got us really able to work under pressure and handle situations. We get feedback from our peers that were in the program with us that kind of got us to strengthen our, work on our strengths and address our weaknesses in terms of interacting with guests and following through. And we're also able to advocate for our guests more. In the past, it was 3 violations, and you were asked to leave. We're more so on the treatment aspect of things. We're looking to we acknowledge the fact that relapse is part of recovery, and that basically we're trying to refer individuals to services, treatment services, and then trying to work with them to make get where they need to be in terms of their recovery. Give them all the resources, the tools, not just issuing violations and asking them to comply with the rules and not being, able to succeed. Um, for more, we also grew as an organization. We used to have just one case manager dealing with about 20 individuals or 10 or so individuals per caseload. Now we have the income and benefit specialist, we have the mental health and addiction specialist, and we also have an intake coordinator. So we isolated the mental health and addiction aspect of things, so we could pay more attention to the individuals and the stages that they are, and trying to get them, to the services and treatment that they should be based definitely. The treatment services that they will benefit them in a sense. And with that said, the length of stay had to be adjusted. We used to have a three months length of stay or one size fit all, and now we have we go on an individual basis. Based on the progress that they're making with their recovery, they will have a lengthier time at the program. We meet as a team on a regular basis to assess the stages that the guests are, and I just want to say that overall, after our training with Pascal, we've grown tremendously, and we'll continue to grow. That's all I have to say, Pascal. Back to you.
Okay, so thank you guys for sharing. So now, do you want to tell everybody what made you want to pursue your CADC? Why did you guys decide to work with this, or gain the knowledge and insight to work with this particular population?
Well, I could say that I'm devoted to helping people, and we see that the tremendous amount of people being homeless in Morris County. I'll speak for Morris County. To a point in time, substance abuse play a great role in that. So it's just right to get to know the population more, the population that we serve more, and be able and equipped to handle what's coming at us, and so we could set them up to succeed and not to fail, so to speak.
Going off of what Osmond said, the population we work with, being homeless, since it does not discriminate, neither does addiction. So what in our field and our line of work, we're working with a lot of people who they didn't become homeless just because they decided to become homeless. Usually there's something else, some other factor involved, whether it's, it could be trauma based, it could be substance abuse, it could be mental illness, it could be a combination of all three or any two. So getting working towards our CADC was definitely something that was interesting for us to pursue and imperative for us to pursue in order to best assist all of the clients that we're working with and improve our success rates. I've always had an interest in it due to many people who I've crossed paths with struggling with whether mental health and addiction. So I had a route before I even came into the program working at Homeless Solutions.
Thank you guys. So since starting the apprenticeship, what were some of the benefits that you did gain out of it? I know you guys talked about how it using the knowledge that you've gained. You've seen how you're able to change some of the program rules. Hold on. So your program rule. Sorry about that. So now, the program rules have changed, but with the program's rules changing and your insight changing, how did it change you in regards to engaging with your clients? Because as you said, homelessness and addiction, they kind of coincide with each other. But now you're trying to not only provide me a shelter, but you're trying to say you want to be my counselor and address all of these other issues. How is it making that transition or trying to help your clients understand that it's more than just being housed in this facility, that there's other services there to help them?
Yeah, if I may, it drew us closer to the clients. We in conversation we relate more when we speak of when we do our assessments and we have case progress meetings. When they speak, we relate more, and our responses definitely reflect that, and they could tell whether or not you're on the same page with them, and that has helped us tremendously to kind of connect with the clients, build our rapport, and like Elizabeth said earlier, if they're not ready, there's nothing we could do to get them to go through the steps, the necessary steps that would get them to succeed. So by building up the rapport and connecting with our guests, it made our job a whole lot easier. And we're able in discussions of different steps that they need to take, and it just our skill set of using self-disclosure safely, just so they know that we are as human as they are. They open up, and we get to have a very informative discussion, and not just a case manager guest type of scenario. So I just think all around it just improved the situation.
We're better equipped to meet the clients where they're at, and in turn we're able to build that rapport with them and get them to trust us a lot more than previously, instead of looking at us just as an authority figure who's looking to move them out as fast as possible. They see that we are genuinely there to try to help them and work with them on their goals, which is so very important. In the end, if they don't feel supported, they're not going to be trying to make the changes they need to make for themselves if they don't feel like anyone cares. Does that kind of make sense?
Yeah, it does make sense. Trying to help them find out who they are, okay, and that they are somebody. Because as we've all, especially this population, it's easy for them to feel like the world is against them, because addiction is a negative. The addiction is not something like being an attorney, a teacher, or just something positive. It's just the negative connotations just that's surrounded with addiction, with the negative behaviors, the lying, the stealing, the manipulation, and how the drugs internally destroys you, but also destroys everybody around you. So now
Hmm.
to have people generally want to help instead of just viewing as, well, it's a shelter, they get paid just that I'm here. No, you tested positive. What's going on? Talk to us. Let's see how we can help you address some of these outside external issues. But during the apprenticeship, what is one we as you know, it was a 1 year process, the whole entire apprenticeship. Um, and we as you I believe you guys mentioned, we did role plays, we talked about the presentation, we did PowerPoints, case scenarios, took exams. But through that process, what is one thing that stuck out to you that you would like to share, excuse me, would like to share with everyone, and how did that particular thing um, help you become who you are today as in your current role at Homeless Solutions?
Um, I'd say the different methods of counseling, different therapeutic approaches, I'm sorry, was really beneficial because it's not a one size fits all with the clients. Each individual is very different. So what works with one client and one approach that works with one client isn't going to work with another. So learning the different methods and being able to implement them gave us a lot more flexibility in terms of how we approach them, how we worked with them, how we were able to guide them in the right direction. It really it added a whole nother way, of how we were previously. It was cut and dry. Now it's a lot more, there's a lot more flexibility, a lot more movement almost, where we can if someone's trying to make things happen, we're there to help them on that journey. And we also know, going through the class, we know how manipulative people can be when they're in just in active addiction, and sometimes they just need someone to call them out on that in a respectful manner, but say, like, listen, I know that this is not the case, you're not being fully truthful, and sometimes they just need to hear it that way, and it really gives them a whole new perspective. So
Yeah.
it's really, I think the counseling methods were definitely something that stuck with me.
Yes, I agree. And another aspect of the training that I really loved and really helps me is the fact that we're doing role play, but at the same time we're listening to our peers as they go up and they perform. We switch roles, and we're able to listen more. I remember Pascal telling us to, a lot of times we just have to listen. And by just listening to the guests, we are able to, sometimes they just want to talk, let it out. And that's therapeutic for them. And at the same time, we're able to grasp a lot of information that we will never normally don't get by just asking questions. Just having an open door policy and having the guests come in and just tell them, hey, just talk. Let's talk. Let's see what's going on. And then we'll gather a lot of information that we could, implement into our service plans that will benefit them in the long run. So I just thought that sticks with me, and it continues to help us, assist the guests or the clients to meet their goals and be successful.
So, what would be one thing that you guys, if you had the opportunity to tweak it to help improve the program, what would be that one thing and why?
That's a good one. So the one thing, I love everything about the program, so it's kind of hard for me to say. But I think to have more increase more interaction, do a lot of more of that role play, and also having to uh, have more having a guest or clients involved in the training, or having more videos to show us exactly what to expect. So when it actually happens, you'll see how it was demonstrated. Could definitely help to have professionals that are currently in the field demonstrate or have role plays with us. That will help because we always learn from our experiences. So I just think those could definitely help improve the program.
The only thing I could think of would be more group exercises to implement. Does that am I making sense on that one? So, different exercises to work with the client on when doing a group setting. So whether it's, having the beach ball that has different questions on it and sharing that around and tossing it around or rolling it around depending on the situation and the group you're with, or different methods of that nature. So different activities really to implement in groups that will help promote more openness amongst the group and a more therapeutic environment in a group setting. I think that would have been very beneficial.
So from what I'm hearing, being able to have more opportunity to make it more live instead of just sample, like an actual program per se, to be
Right.
able to have real clients, real activities to do, just to also home in the experience, or do more application of the experience instead of role play.
Correct.
Okay, that makes sense. But one question I was posed was, I'm going to summarize it, is did participating in this apprenticeship, did it help boost your career, open more career doors for you?
Definitely did. I see myself growing in the organization, and that added to it. It kind of like set me up to succeed. In conjunction with everything else that's happening, all my performance, I could definitely tell you that it was a positive aspect doing my performance evaluation. Yeah, I maintained my role as a division manager, and now have to manage two programs. We're working towards possible drug and alcohol program in the company. So definitely, it's opened up a lot of doors.
I'd have to agree. It definitely has helped with the progression of my career with Homeless Solutions. And, I'm looking forward to seeing what is next, what's to come as we move forward with the new program that we're going to be starting.
The question was posed asking me, how was it when in regards to developing the program? Um, that was pretty much very simple, because one, I know I have to teach the class, right? And being able to teach the classes, you have to be able to understand everybody's learning style. So some people are tactile, some people are visual, some people are more auditory. So knowing that and understanding what each dynamic of the courses were, I just pretty much created a program that will implement all styles of teaching. So everybody gets to participate in it in some way or somehow, some fashion, and will also heighten their understanding and being able to apply, implement what they learned. At that time, Homeless Solution was not pursuing their, to become a licensed facility, although they're doing that now. But the students were able to apply some of the tools to into the clients that they're working with, the shelter, whether it's the families, the ones that work with in conjunction with case management with Mental Health Association of Essex and Morris in Sussex, um, probation, parole, just general or just community based, because there were a lot of the clients that were in Morristown, as we know where Homeless Solution is located, there's not that many treatment providers. So they have to say, okay, where would we send them? How would the clients get there? So we just pretty much made it as live experience as possible, but also too using the support of the team and Homeless Solution administration team and management team and the staff willingness to participate and learn made the program be such a great success that Governor Christie at the time did visit. Remember, guys, he visited us and we were interviewed. We were asked questions. I know everybody, all of us were nervous, but as we started talking, it was as if, what's there to be nervous about? We're talking about things that we do every day.
Right.
Okay. So maybe, if you don't mind taking some time, just talk about that opportunity that you had meeting Governor Christie and had a chance to talk about the program and your implementation, applying the program at the facility.
Yeah, it was definitely a big deal. I believe we got notified that we'll be having the governor pay a visit at not enough time. But it was very, very interesting to say the least. We had the governor there, and we spoke basically on the fact that there was a opiate epidemic going on that kind of like is affecting everybody, and the topic about addiction not having any barriers. It doesn't matter. It doesn't discriminate, just as mental health or homelessness. And so there was a lot of emphasis on trying to put an end to the opiate epidemic, which we felt like we played a major role in, and will be playing continue to play a major role in addressing. So we were part of the solution, and it was great meeting the governor. And I believe after that interaction, went to two more uh, open discussions that the governor had, and it was all surrounding the fact of putting an end to the opiate crisis, and felt the need to continue to work with the substance abuse, the addictive population, to continue to address the behaviors, and help them in any way possible.
Yeah, as Osmond had mentioned, when we met with the governor, it was definitely an amazing experience, because you're in this room with someone who is just, they are very powerful. And he got to see firsthand, what we're doing to try to be a part of the solution. And I was actually very honored to have one of my own clients be able to speak to the governor and share her story of, her story of addiction and getting sober and everything she went through. So it was such an awesome learning experience, just being there and discussing, as Osmond mentioned, the opiate epidemic and what we're doing to try to, play a part in ending that epidemic.
Thank you. I mean, for me, it was an honor. Um, I was nervous. I'm not even gonna deny that. But as we started talking, and the beauty of having such person in your presence who had the authority to even help assist and advocate for more resources for this population, or trying to help us advocate more and more services to help this population, was my primary focus, and some of the questions that we did ask at the time. And it kind of perked him, give him another perception to say, hey, these are people that's in the field. These are people that want to become in the field. And these are people that's working with these individuals and have their ear and witness their day-to-day struggles. And by us being able to not only share our insight and what we learn in the classes, but our experience and present it to him, I think before he did exit office, he was able to make some changes or even refer to the next person that can make those changes. And I think that's what I really truly enjoyed or with that opportunity. Um, from is there anything else that you guys may think that we may need to that we didn't mention pertaining to that apprenticeship program? I know we talked about the different stages, coping mechanism, therapeutic, the role plays we did, the different tools. Um, but career wise, now that you have your foot in the door and now it's just waiting to take the exam, where do you guys see that you'll go once everything is in place for you? Do you feel like you're going to continue working in this aspect, case management, or do you want to go more into the counseling aspects, or just what is it that you see that you want to do using the tools you've learned from this apprenticeship?
Go ahead, let's see you.
So I think I would like to delve deeper into the counseling portion of it. Working one-on-one with someone is something I've always been very passionate about when it comes to what I do, and that's why I originally went into doing case management to begin with. So I think the one-on-one would definitely be something I'd like to focus on going forward.
Yeah, I'm in a position now that I'm not doing one-on-ones. I'm a division manager, but at the same time, it's good to have that experience. I definitely step in when I need to, if I have to. So definitely have. I see myself continuing to uh, learn how to engage the clients. Addressing, referring them to services and being the positive, having a positive role in their lives, and assisting the staff to make the right decisions, and that would benefit both the clients and the organization. So I see myself definitely following through, and maybe getting more involved with group sessions, and building my skills there. And because I heard that from not just the one-on-ones, get into a group setting will definitely enhance our abilities to serve um, um, the population even at the higher level. So
So we only got 3 more minutes, so I'm thinking 2 minutes left. At this time, I want you guys each to really share what, if you were to make a recommendation about this program to somebody, anybody who's listening who's might be interested in becoming a CADC or participating in this apprenticeship, what suggestions would you give to them? How would you help them understand this program, to describe it, and what benefits or what they could look forward to receiving by participating in this apprenticeship?
I'll say it's a wonderful program, and go for it. It definitely will put you ahead of the game. It'll definitely set you up to succeed, and you get to get insight, on how to proceed and address, and links against clients to the appropriate services. It's a game changer. I learned a lot, like I mentioned, just by listening. um, we do a lot of listening and implying the techniques. The basically just go for it. That's all I could say.
I'd have to say it is definitely an excellent program, and you can expect to learn a lot of different things that you thought you knew already. So, the different counseling methods, the quadrants of care, and learning how to assess clients for for the quadrants to determine, what is their primary focus, what type of treatment referral do they really need, and learn how to make those referrals and assess the individuals. It's definitely I would definitely recommend it for anyone who's looking to pursue something, a career working with those who struggle with addiction and to get their LCADC or CADC. It was definitely an amazing experience.
Thank you, guys. As for me, I would recommend it. Any body who would like to enter a field to help people understand who they are, help them get back on track, but have with the understanding that you have to meet the clients where they are. Okay, that's where it all starts, and this field continues to evolve. Okay, it's changed so much over the years and the decades that we started having a CADC and now have an opportunity for you to learn, to understand, to help the families understand how to help the communities. And there's so much branches to it that you could do. It's not more than just counseling, but just case management, community liaison. Everybody plays a part of it. Family counseling, it plays a part of the recovery process. And by doing that and we all working together, I think it only give a person a chance to succeed.
Mm-hmm.
And that's what I really enjoyed about this. And meeting new people, as much as I said I've been doing this for 21 years, I also had this chance to, I'm always open to learning. So working with the homeless solution team and teaching them, they also taught me as well. So that's the beauty of it as well. And working with the Rutgers team as well, who were overseeing this program. So I want to say thank you, everybody, for your time and have a blessed day.
Thank you, everybody.